self-destructive healing, it's one and the same. Whoa. If the only content you've seen me make is my music video reaction, psychiatric perspective style videos on my channel, you might not know that I also do a Medications Monday bit where I look at different medications and talk about the psychiatric perspective on them and just give general advice. Nothing specific, obviously, but just general advice. And I go through my textbooks and I talk about, side effects and indications and complications and all that kind of stuff. But rarely do I have a song that does the job for me. So I'm actually kind of going alphabetically, more or less, and I haven't gotten up to the letter D. But there's a song by Ren called Diazepam, and I've gotten a couple of comments to react to it, which is great. So I will, and maybe it'll talk a bit about the mechanism of action and the side effects and that kind of thing. So I'm hoping this video can be a 2-for-1. It can serve as a kind of discussion around the medication in general terms, and also a music video reaction just because I enjoy doing them, so it's a bit of fun. If you're new here, a warm welcome. My name's Dr. Sill. I'm a junior doctor from Australia working in mental health. And in my free time, I do mental health, educational and entertainment videos. All advice that is discussed here is general in nature. There's no patient-doctor relationship formed from watching these videos. If you think you need to talk to a professional, please seek medical advice. Now let's chuck the headphones on and get into it. Okay, so right off the bat, I can see that the song is only 3 minutes and 30 seconds, which usually means I talk. I don't know why, but the shorter the song, the more I talk. And I don't think it's because I have an unconscious need to talk more because I'm scared the video will be short. I think it's more the fact that when songs, especially by Ren, are this short, the intensity of the content is much more significant. So he packs so much meaning into such concise verses. So anyway, let's go. That's nice.
Oh my, I seem to feel so much better when it kicks in. Chemical kitchen, feel my brain destruct. Oh, Diazepam In, turn that volume down on my demons and you give me relief just for a second and you make it all so numb.
Whoo! That's a nice, that's catchy. That's kind of, is it reggae? That's not quite reggae, but it's got that kind of vibe to it. He's got such a beautiful voice. So let's talk a little bit about diazepam. Look, it's kind of got similarities to alcohol in that it's a GABAergic medication. GABA is a neurotransmitter that inhibits neuronal activity, and so when neurons are firing in your amygdala, the fear center and anxiety center of the brain is firing, alcohol or diazepam can help turn that all down. But just like alcohol, if you have it for a long amount of time, you can develop a tolerance to it, so you need more diazepam to have the same effect, and a dependence on it, so it's hard to stop. But it is used in alcohol withdrawals because we can dose it safely and in a controlled way so that we can wean people off it in a safe, controlled setting. So if someone has dangerous alcohol withdrawal symptoms, because by the way, alcohol withdrawal can be lethal. People can get into status epilepticus, they can get delirium tremens, and they need GABA, that neurotransmitter that the diazepam potentiates. But the goal is to slowly come off of it, and gosh, it's hard. When you see people who are withdrawing, it's misery. It's just the hardest thing they've done in their life. It's my heart goes out to them. So that's one use case for diazepam. It's kind of alcohol withdrawals. Now you've got to be careful. If someone who's been drinking a long time has liver problems, then diazepam's not the right medicines for them, and that's why you got to see a doctor. You got to get specific medical advice. This is all general in nature. The other use case for diazepam is anxiolysis. So someone who is dysregulated in a panic attack, whatever the case, it can be used as needed medication and can help reduce the risk of impulsivity, acting out on these terrible thoughts that someone might have, and can sometimes just be used in the interim whilst some antidepressant medications and psychotherapy is taking effect. Because the time to effect for these antidepressants is generally 2 to 4 weeks. You should see something after 2 weeks, but sometimes up to 4 weeks before you really get something felt. And therapy also takes time. So in the interim, diazepam works quite quickly. Maybe things are going to change with ketamine and psychedelic-assisted psychotherapy and transcranial magnetic stimulation. These are all new kind of therapies that might change the landscape, but it's all under researched and quite new, so we need time. But at the moment, that can be a use case for it. The goal is to not use it long term and to come off of it slowly, and if possible, not to use it regularly, but on an as required basis. But I know that a lot of people who watch this content have had really horrible experiences on benzodiazepines. They describe benzodiazepine withdrawal as one of the worst experiences of their life. The electric shocks that people get, the headaches, the physical symptoms of withdrawal with the nausea and vomiting. It's a really horrible syndrome. And I think that's something I didn't appreciate before getting into medicine, how physical drug withdrawals are, how sick someone can look. I mean, you can look at someone who's withdrawing from alcohol or any drug, but the images I have in my mind are from people who have withdrawn from alcohol, and they look like, they look terrible. They're so sick. But diazepam does help, and it can be life-saving in people who have vulnerability towards getting seizures or delirium tremens.
Oh, why, diazepam, do you make me feel like everything's not dissolving? Spinning doors are evolving, swallow a tablet, I'm overindulging. I've tried diazepam to be the optimist and resist cards folding. You're the crutch that I'm holding, don't want tomorrow, cause right now I'm golden.
Sorry, there's another really good line that just reminded me of, where he said, you turn down the volume of my demons. It was a really good line that he said in the song. And that made me realize it's a really important use case in diazepam, that it can also be used to manage agitation, right? And we often will prescribe benzodiazepines in someone who's psychotic, but it's not an antipsychotic. But if someone has psychosis, like take a paranoid persecutory psychosis where someone feels they're getting attacked or followed, or they're about to be, like some secret government body is going to spring on them and attack them and hurt them. Like, that is a terrifying place to be. It is horrible to have that kind of psychotic syndrome. And they're so scared. And I always try and provide as much reassurance as I can, but the words that I'm saying sometimes are not in their reality. I'm just this fog to them. I'm hardly in the room from their perspective, because the room is derealized. They're reality testing. When they're hearing my voice speak to them, they look through me. I'm not their reality. So there's only so much words can do. And so benzodiazepines are also very important in the management of psychosis. I'm sure there's lots of other indications that I haven't commented on here. This is just what's coming to my mind in general terms. But he talks about turning down the volume of my demons. So yes, technically from a textbook point of view, everyone's different, and diseases don't read textbooks, as they say. But you would conceptualize that the benzodiazepine reduces the agitation from the psychotic symptoms, but the antipsychotics is what would turn down the volume of the symptoms. So there's the symptoms and the distress from the symptoms. You can call that secondary anxiety or secondary agitation from the psychotic symptoms. Diazepam theoretically wouldn't have much impact on the intensity of the symptoms, but it would change the response to those symptoms, the agitation and the anxiety that comes from the psychotic symptoms. So what do you do for the psychotic symptoms? Well, there's lots we can do. It's antipsychotic medications, ECT, clozapine, paliperidone. There's lots that we can treat psychosis with. But yeah, the benzos usually focus on the side effect of the psychotic symptoms. And so antipsychotics might be used lifelong, right? Especially in something like a schizophrenia syndrome. But benzodiazepines, you try not to.
Tomorrow, 'cause right now I'm golden. Oh, diazepam. Don't lie, diazepam. Oh, ma, when you leave, why can't I breathe like you've stolen my very essence, my coding? Went for a swim and then drowned in your ocean. Don't lie, diazepam. You promised me the world, but now I'm rotting and molding. And my face, it feels swollen. Anesthetic, I block that emotion.
Gotta let this guitar solo go, because that was just pure feels. Oh yeah, I really enjoyed that guitar solo. So this is interesting, right? We've started off the song by talking about how golden it is, how much it helps turn down the demons and numbs the negative things. And now we're starting to see the cost. This is a very cool story arc from Ren. He's talking about, now when you leave, I can't breathe. Right, like that's the panic attacks. That's the affective dyspnea, where you feel like you can't get to the bottom of a breath because you're feeling so anxious. That's something that happens to me as well when I feel anxious. And what a incredibly powerful line that I'm sure a lot of you like. I went for a swim and now I'm drowning in your ocean. This is definitely in hindsight what a lot of people with panic attacks or something, like if someone has panic attacks and is charted diazepam and it helps with their panic attacks in the short term, but then they develop the dependence on the diazepam and then they have to wean it off, there's often in hindsight this regret where they feel like it wasn't worth it. At the time when they're having the panic attacks, they want anything they can to help, and then after the fact when they're looking back, they just, because of how hard it can be to come off of these kind of substances, if it's used long term and I won't say inappropriately, if it's used long term for whatever reason, it can be very hard to come off, and that's so hard that people often regret going on it in the first place. So everyone's different, right? There's no rules, and some people it is used long term, and that is appropriate. So that's important to say that some people are on diazepam long term, and it is appropriate for them. And we're not making any value judgments on anyone, but it can be hard to come off, and if you get, that's just such an evocative line. I went for a swim and now I'm drowning in the ocean. Like I just needed it a little bit, and now I'm overwhelmed with it. I don't know. What does that do to you guys? Does that evoke anything? Also, if you're enjoying this, don't forget to like. I'm definitely liking. I'm already subscribed with notification bells to Ren because of how beautiful his music is. But yeah, if you enjoy this content, consider leaving a like and subscribing for more. Comment any other reactions you want me to do. Let's keep going.
I'm carried away. Anesthetic bleeding, a place for the pain. Self-destructive healing is one and the same. Oh, diazepam. Synesthetic dreaming, I'm carried away. Anesthetic bleeding, a place for the pain. Self-destructive healing is one and the same. Don't lie, diazepam. Synesthetic dreaming, I'm carried away. Anesthetic bleeding, a place for the pain. Self-destructive healing is one and the same.
self-destructive healing, it's one and the same. Whoa. I haven't heard that before. That's pretty profound. Jeez. Self-destructive healing. Yeah. Look, when we have inner conflicts that are generating anxiety, there are unconscious and conscious elements to these inner conflicts. And anxiety is the manifestation of the pain from these conflicts. Now, if you know very little about your unconscious because you've had to block it out to protect yourself when you were younger or whatever, then that can be really tricky because, well, often people in that situation will look for external locuses of control. And medication can act like that. Medication can be an external locus of control. It's like, here's my inner anxiety, here's my pain. This will save me. This will be my savior, this external thing. That can be a problem because often to make long-lasting change, if we're talking at the time course of years, there has to be the balance between the external and the internal factors. It's very rarely, I don't think it's ever really your fault that you have these conflicts, these unconscious conflicts, right? But it can be your responsibility to explore them in a safe way for you. And that might just, involve going to seek help, seeing a professional, getting a diagnosis, and if there is any mental illnesses, making sure they're treated appropriately. That's all really important stuff. But I guess the point I'm trying to get at is it's okay to use medications to treat illnesses, of course, but you don't want to go to the point where it's like you don't have to do any of the work. I mean, it sucks that you're in this state, but therapy is very important for almost. I can't think of a mental illness where therapy isn't an important part of the treatment. And therapy is I'm taking responsibility for what I can change and what I can do. And it's interrogating what I'm doing that's not that ideal and what I can do to improve things it's taking charge, it's taking autonomy. And I guess when we do medications, it's just important to remember that yes, it's an external help, but you've also got to do your own internal work to help yourself from the inside out. That's a good way to think about it, actually. Medications is kind of helping your problems from the outside in, but it's also important for you to do work from the inside out. And that's why the evidence is very clear that for things like depression and anxiety, a combination between medications and therapy works better than one or the other alone. So doing the combo is what gives the best outcomes, right? So that's an important take home from here. All right, thanks, guys. An interesting song. I don't think it probably got to the level of depth needed to make it a Medication Mondays video. So I probably still will do a diazepam video in time. I think I've done clonazepam already, which is one of the other benzodiazepines. Or anything that most of the drugs, if they end in PAM, it's usually a benzodiazepine. I can't think of an example of a medicine that ends in PAM that is not a benzodiazepine. If you guys can, put it in the comments below. Cool. Comment down below anything else you want me to react to. And other than that, I wish you all a beautiful day and I'll see you in the next video. All right. Bye for now.